Here.
Hello, Dr. Oksana.
Hello.
From Kiev
Hello,
Medical University, Ukraine. Hi, how are you?
Yeah. Now, thank you very much for this for my just. Sorry, I will try to. Yeah. Can you hear? Can you see my presentation?
Yes. Yes.
Hello, everyone.
So, Dr. Oksana will be talking about metabolic syndrome and cognitive impairment in aging patients with cerebrovascular disease.
Yeah. Hello, everyone. My name is Oksana Kopchak. I'm head of the Department of Neurology and Psychiatry at Kyiv Medical University in Ukraine. So my topic will be devoted to metabolic syndrome and cognitive impairment in aging patients with cerebrovascular disease. The number of old patients with cognitive decline and dementia is anticipated to increase rapidly and become a world health problem due to the aging of population and increasing mortality rates and economic waste. According to WHO forecasts for 2050, the number of people suffering from dementia will constitute more than 120 million in the world, and 70% of them will be from low and middle income countries. Actually, it's a great problem. And Alzheimer's disease played the leading role in the dementia emergence, and it accounts 70% of cases of dementia. In a number of countries, the cerebrovascular disease is the second recorded course of dementia after Alzheimer's disease in elderly and senile age patients. Let me talk about the heterogeneity of vascular cognitive impairment. So you know that vascular cognitive impairment can be due to the ischemic lesions, such as large infarcts, multiple infarcts, strategic infarcts, silent infarcts, microcortical infarcts, and vacuums, as well as white matter lesions, loss of white matter integrity, and enlarged perivascular spaces. Also, cognitive decline can occur due to the hemorrhagic lesions, due to the primary intracranial hemorrhage, also arteriovenous malformations, dural fistula, microbleeds, and superficial siderosis. You know that Alzheimer's disease and vascular dementia, they have their similar risk factors. And here in the middle of the slide, you can see their risk factors, which are typical for both Alzheimer's disease and vascular dementia. And among them, there is aging, history of stroke, hypertension, type 2 diabetes, metabolic syndrome, smoking, stress, dyslipidemia, heart failure, depression, hyperhomocysteine, physical inactivity, and presence of ApoE4 And what is actually metabolic syndrome? Here you see the criteria of the metabolic syndrome. The diagnosis of METS can be put if there are 3 or more of the following factors in one patient, like obesity, dyslipidemia, elevated blood pressure, high fasting plasma glucose level. And here you can see the pathogenesis of all the changes which take place in case of metabolic syndrome in our patients. High caloric excess and positive energy balance, it starts from it. It causes the increased number of adipocytes in visceral and abdominal fat, and which in turn causes a low metabolic inflammation and impairment of adipokine secretion and insulin signaling. Then triglyceride storage and increase of basal lipolysis, C-reactive pain, and also other interleukins and pro-inflammatory cytokines, which cause in turn the activation of macrophages and also triggers the release of monocytes, B lymphocytes, and burst them into circulation. Which cause increased insulin resistance in adipose tissue and also that cause impairment of the metabolism. And all these mechanisms with additional metabolic problems like hypertension, diabetes, high cholesterol levels, which can lead to occurrence of stroke in these patients, can cause cognitive decline. Here you see that not only everything starts at a genetic level, the presence of ApoE4 genotype, and then it's a risk factor of cognitive decline. Then you see the cellular mechanisms like brain insulin resistance, glucose toxicity, oxidative stress, and inflammation, chronic inflammation, which take place as well. Then breakdown of blood-brain barrier and neuronal cell damage, which also in turn cause the impairment of endothelial surface of the blood vessel walls, and also the impairment of either regulation, and it causes hyperperfusion of the brain tissue and infarcts. And all these changes globally cause the changes in the brain structure, and functional outcome of which is the changes of cognitive functioning of our patients, like decrease of the executive function, memory decline, gait and balance problems, brain engine, and cognitive decline at the end. And all these components of metabolic syndrome, they can they bring their part into the development of cognitive decline in our patients. Like you see that glucose dysregulation can cause cognitive decline through the influence of the chronic hyperglycemia and the increased inflammation ratio and alteration of myelination of neuron fibers, and also aggregation of beta amyloid and accumulation of tau protein. And obesity also plays an important role in as a component of metabolic syndrome in cognitive decline in our patients. Also the same mechanisms, and in the center of all this mechanism you see the inflammation. Hypertension can cause the damage of small vessels and as well as reduced cerebral perfusion and formation of leukoariosis and lectin infarcts in the brain tissue. As well as dyslipidemia also causes increase of beta amyloid deposition and amyloid angiopathy as well. If we come back to obesity and cognitive decline, there is an amount of evidence that obesity adversely affects the central nervous system and especially cognitive function, especially such domains as attention, executive function, decision making, verbal learning. And these data are from the meta-analysis that showing that obesity doubles the risk of Alzheimer's disease, and also in midlife it can predict greater risk of dementia in later life. BMI, body mass index alone, is a predictor for temporal lobe atrophy, and there is evidence that obesity increases the risk of mild cognitive impairment independent of age. Using diffusion tensor imaging, the measure of brain white matter volume of elderly subjects with normal cognition showed that those with increased BMI and hyperinsulinemia and type 2 diabetes had more atrophy in frontal, temporal, and subcortical brain regions, areas which are involved in learning and memory. And having analyzed the post-mortem studies of 12 cases show that the elderly people with morbid obesity had increased concentration of hypercampal markers associated with Alzheimer's disease, such as beta amyloid and tau proteins accumulation and decreased hypercampal volume. In animal models, we can also find some evidence that obesity is tightly associated with cognitive decline. Like animals with obesity had modifications in hippocampal structure and function, and also memory and executive function deficit. Long-term potentiation as cellular correlate for memory function was impaired in mice of hot fat diet, with also, of course, reduction in neurogenesis, synaptic plasticity, and levels of brain-derived neurotrophic factor. But in some cases, we can find another data in literature, like in a large retrospective study which included 2 million of individuals who were followed up for 20 years. No correlation between BMI and dementia was shown. And now I would like to draw your attention to one systematic review, like metabolic syndrome and cognitive decline in elderly. This review includes the analysis of 25 studies out of 505 studies devoted to the investigation of association between metabolic syndrome and cognitive decline. And here you will see all these studies. Some of them are longitudinal, some of them are cross-sectional studies, but in all the studies you can see that nearly all the studies use the same criteria for identification of metabolic syndrome, but in some of them the cognitive function assessment differ from study to study, but most of them use mini-mental state examination for assessing of cognitive functions of the patients, and also some of these studies has the follow-up duration. What about the results of the studies? You see that in a large amount of studies, the relative risk was positive concerning the association of metabolic syndrome with cognitive decline. And in some studies, this risk was associated with a low HDL in the serum of patients, and with high blood pressure, as well with high fasting glucose. And in only one study, it was associated with central obesity. Here also the continuation of this systematic review, and you see that metabolic syndrome in most of the studies was tightly associated with cognitive decline. This is a summary of this systematic review, as you see that actually the results and the findings were divergent from this study, but I would like to conclude that we need larger and higher quality studies in this field to make a really conclusion. So we should continue our investigations. But what about the oldest all, those patients who are more than 90 years? The data on metabolic syndrome in the oldest old persons appeared to uniformly indicate a protective effect of metabolic disorders for cognitive functions of those subjects. It has been suggested that the role of metabolic conditions may change over the course of life, and that the thresholds used for young adults could not be appropriated for the older population. Adaptive changes associated with aging may result in altered vascular activity, body composition, and metabolism, which is, instead of harmful, can be beneficial for older adults' health and cognitive function as well. Some studies stated that body mass index below 25 may be a risk factor for cognitive decline and mortality in elderly subjects. And late life hypertension in oldest old may prevent the onset of dementia. Now I would like to focus on our own study. The aim of our study was to establish possible relationships between metabolic syndrome, its individual components, and cognitive impairment severity in different age groups of patients with cerebrovascular disease and metabolic syndrome. There were 503 patients aged from 45 to 89 years with cerebrovascular disease enrolled into our study. They were divided in two main groups, without meds and with. The groups were made for age, sex, and education, and these all two groups were divided into three age subgroups: from 45 to 59 years, middle age, from 60 to 74, old age, and the oldest old, the senile age, from 75 to 89. Those patients who had cerebrovascular stroke, aphasia, dysphasia, brain tumor, hypothyroidism, severe head trauma, Parkinsonism, premorbid psychiatric illnesses like schizophrenia, depression, mental retardation, severe sensory impairment, drug, alcohol abuse, severe chronic medical disease, or also the receiving medications, and those as well who refused to participate in this study were excluded from our study. The study was also approved by the Institutional Ethics Committee. The methods. We used the physical and neurological examination, including weight and height parameters, just to calculate the body mass index. Also, we checked the blood pressure, and we used the same criteria, the criteria of the National Heart, Lung and Blood Institute criteria, the American Heart Association, the World Heart Federation, Institutional Atherosclerosis Society, for the metabolic syndrome for all the patients, and neuropsychological examination also was conducted in our patients and included mental state examination scale, help us to assess patients' ability to for time and space orientation, short-term, long-term memory status, speech function, gnosis, praxis, and also we used the test for memory, like methods of 10 words learning, the paired associates learning test, then Shelter tables, which help us to determine the rate of sensory motor reactions, mental performance, and attention, as well as clock drawing test, frontal assessment battery, and according to mini mental state examination, score of 29 to 30 was considered as absence of cognitive impairment, score 28, 27 like pre-MCI, 25, 26 MCI, and score less than 24 or equal a point the dementia. We also performed laboratory tests just to check the level of fast glucose, lipid profile, and also concentration of the thyroid gland hormones. All the patients had the MRI of the brain, and we got the results of our study. Actually, if we compare two groups without metabolic syndrome and with metabolic syndrome of different age, so you can see that in the middle group of patients with metabolic syndrome, the frequency of MCI was significantly higher, as well as the frequency of dementia in old age and senile age group, subgroups of patients with metabolic syndrome was significantly higher than in the corresponding subgroups of patients without metabolic syndrome. As for results of the other neuropsychological tests, you can see that those patients who had metabolic syndrome had significantly worse results concerning their attention and sensory motor reactions according to the Shelter tables, and also the score for the clock drawing test and frontal assessment battery. And also we have found the negative correlation coefficient with between the systolic blood pressure, triglyceride level, and fasting glucose level, and mini mental state examination score in the patients with metabolic syndrome. Here are the results of the correlation analysis in the different subgroups of patients with metabolic syndrome. Here are the results of the middle-age group of patients, and here you see that there was significant negative correlation between the level of systolic blood pressure and mini-mental state examination score in this subgroup of patients, and also the negative correlation between significant negative correlation between the mini-mental state examination score and also the level of elevated blood pressure and the duration of the hypertension, and the positive correlation between mini-mental state examination score and the duration of the treatment of the arterial hypertension in our middle-aged patient. Concerning the patient of the old age, you see that here was the significant negative correlation between the level of the systolic blood pressure and the mini-mental state examination score. The higher was the level of systolic blood pressure, the lower was the score of the MMCE. And also here was significant correlation between the negative correlation between mini-mental state examination score and duration of arterial hypertension. The more was the duration of the arterial hypertension, the lower was the mini-mental state examination score in this group of patients. And now we are talking about the last group of patients with MED, the senile age patients, and here you see that there is the positive correlation between the systolic blood pressure level and the mini-mental state examination score, and diastolic blood pressure level and mini-mental state examination score. The optimal level of systolic blood pressure was 140 for the cognitive, for the score of mini-mental state examination and assessment, and for the diastolic, it was 90, which was better for the cognitive function of the senile group of patients, but no significant correlation was found between the duration of arterial hypertension and the duration of treatment in this subgroup of patients. Also, we compared neuropsychological tests in patients with metabolic syndrome depending on the presence of type 2 diabetes. Our patients were divided into two subgroups, with diabetes mellitus and without it. And you see that the significant difference was found according to the mini-mental state examination score, and also delayed associate memory level and level of attention and sensory motor reactions, and the frontal assessment battery score. So it's the last but not least, I would like to talk about, I would like to conclude actually my presentation that the presence of metabolic syndrome in patients with cerebrovascular disease leads to deterioration of their functional state and the functional state of the central nervous system, and is accompanied by increasing cognitive problems in these patients. Age is a very important risk factor of cognitive impairment, and severity of which increases in the presence of metabolic syndrome in patients with cerebrovascular disease. In the analysis of the relationships between the parameters of the main components of metabolic syndrome and cognitive functions in patients with cerebrovascular disease, negative correlations between the level of systolic blood pressure, fasting glucose, and mini-mental state examination score was established, taking into consideration certain peculiarities in different age groups. As you have seen, that in patients of the middle and old age groups was negatively, systolic blood pressure was negatively associated with mini-mental state examination score parameters, whereas in the patients of the senile age, positive correlations between systolic and diastolic blood pressure indicators, and mini-mental state examination score was found. Also, we found significant negative correlation between the duration of arterial hypertension and mini-mental state examination score in the middle and old age groups of patients with metabolic syndrome, but an increase of serum fasting glucose levels negatively also correlated with mini-mental score examination score in the middle and old age groups of patients. So if we act in time, and if we have adequate correction of blood pressure levels, serum glucose, triglyceride levels, it can positively influence the cognitive functions of our patients in the case of combination of metabolic syndrome and cerebrovascular disease. And taking into consideration the current available data of all the investigations and concerning the impact of metabolic syndrome on cognition of older population, these data are inconclusive and they are based on inconsistent evidence. And therefore, we need larger and high quality studies in the field to maybe to understand what is the main idea, because I think that now we can make a conclusion, but the further investigations maybe will shed light in the area. Now I would like to thank for your attention.
Thank you, Dr. Oksana, for your presentation. And if there's any question?